Let's learn about reprocessing of single-use hospital infection control element of NABH. The organization should provide adequate space and appropriate zoning for sterilization activities. Cleaning, packing, disinfection, and sterilization. The storing and the use of item is done as per the returns guidance. Reprocessing of single-use instruments, equipment, and devices are done as per written guidance. Regular validation tests for sterilization are carried out and documented. The established recall procedures is implemented when a breakdown in the sterilization system is identified. So herein we will stress upon this reprocessing of single-use instruments. To simplify the it means the HIC 70 element of NABH means the organization should have a documented policy and procedure reprocessing of devices whenever applicable. That is, the organization identifies those devices which are meant for reuse. The number of reuses and the process of reuse are defined and monitored. The patient is informed about the same, and documented policies and procedures shall be in consonance with the available good practices. Single-use device is a medical device that is recommended for single use on one patient for a single procedure. They are not intended by the manufacturers to be disassembled, cleaned, reassembled, and reused, since doing so may jeopardize its physical and or chemical integrity, performance, safety, and effectiveness. SUDs are classified as generally as unopened, opened, and used, opened but non-used. As per Spondy's classification as non-critical, semi-critical, and critical. Then the non-reusable SUDs are needles and syringes and urinary catheters. Reasons for reprocessing are cost-saving measures, like in developing countries, reprocessed items are used on poor patients. Environmental advantages is that reducing the medical. Now, but the risk associated with the cross-infection, altering the working of device, stress devices may break while reused, chemical bonds due to disinfectant using cleaning, endotoxin reactions, non-validation of SUDs don't undergo extensive testings and validation by the manufacturers to ensure the device is safe. So there should be a reuse committee in the hospital for the same, which will compromise of the end users like physicians, surgeons, nurses, HIC officers, team, the administrators, the CSSD in charge. Then there should be listing of SUDs department wise. There should be consensus of for the same as per the material of device, the cost of device, the number of items reprocessed. There should be color coding uniformly in all the departments for the SUDs. Documentation of SUDs should take place, and tracing, that is the recall protocol, should be in. Now, what are the steps of reprocessing? It is the sorting, then labeling, device tracking, cleaning, testing, package, sterilization, SOD recall, and disposal. Regarding audits to assess the compliance, the periodic audits should be done to check all the steps of reprocessing are going with the set protocol. That is 4 times a year, or as per the hospital policy. Surplus audits should be done to check the compliance with the policy and documentation. Staff training and education programs will take place. So, tier 1, that is education, training, and competency. Summary: education and training plus competency audit, that is total test per year. The routine audit of the effectiveness of the cleaning process. Monitoring that is high, that is the risk instruments and equipment. Then in Indian scenario, there is no guidelines for the SUD reprocessing. In-house reprocessing is commonly done by many hospitals. No third-party ethical issues that healthcare facilities will be considered as manufacturer of the reprocessed device. Manufacturer of SUD will be no responsibility for the safety. Patient has to be informed about the use of reprocessed items. If the patient objects to reuse, it becomes mandatory to use new consent. Non-critical surfaces 1 to 100 dilute hypochlorite solution or any equivalent EPA approved disinfectant, that is Environmental Protection Agency approved disinfectant. Example, dialysis chair, external surface, and others. Critical devices like sodium hypochlorite or peracetic acid for hemodialysis, hemorrhage machines, and others. Endoscope is a valuable diagnostic tool and therapeutic. Its examples include gastroendoscope, bronchoscope, and others. Incidence of HAI is high, but these are heat sensitive items. So reprocessing both. There are protocols for the endoscopes for reprocessing. But let's see the steps of a manual endoscope cleaning: pre-cleaning, leak testing, then manual cleansing and rinsing, then drying and storing, then documentation and validity. The benefits of automated endoscopic reprocessors are automate and standardize the reprocessing steps, reduces the personal exposure. Manual pre-cleaning and leak test is a must before putting the endoscopy in automatic endoscopic reprocessors. Alcohol rinse is a must step before storage. Failure of the automated reprocessor have been linked to outbreaks. Thanks.